Welcome to Statistics in Real Life. You probably heard the term of herd immunity used in COVID-19 pandemic. What is the herd immunity? It means when most of the population is immune to an infectious disease, this provides indirect protection or herd immunity to those who are not immune to the disease. How can we achieve the herd immunity? There are two ways to achieve herd immunity. A larger proportion of the population either gets infected or gets a protective vaccine. As the vaccine for COVID-19 is still months away, the only solution to achieve herd immunity right now is to infect many people with the virus. That sounds scary. How many people need to be infected in order to achieve the herd immunity? Let's figure out using statistical model. This video is based on a well-written article, Mass in a Minute, R0 and Herd Immunity, which was published on Plus Mass website. Here's their reference link. If you like our video, please give us a thumbs up. If you want to get most updated episode, please subscribe to our channel by clicking subscribe button below this video. Now, let's get started. For an infectious disease, there is a statistical term called R0. It is the basic reproduction number of the disease. The average number of people an infected person goes on to infect. For COVID-19, this number is currently estimated between 2 and 2.5. The higher R0, the more people an infected person can infect. For example, if R0 is equal to 2, and an infected person infects their victim within a week of becoming infectious, then a single infected person sparks the following groups of the new infections. After 1 week, 2 new infections. After 2 weeks, 4 new infections. After 3 weeks, 8 new infections. After 4 weeks, 16 new infections. At this rate, the entire world population, 7.8 billion, would be infected within 33 weeks. This sounds we're doomed. But the assumption of R0 is that everyone can catch the disease. Once the person has recovered from the disease, they will gain some immunity. In other words, there are some people in the population unsusceptible to the virus. So instead of R0, we should be really looking at R. It is the effective reproduction number of the disease. The average number an infected person goes on to infect in a population where some people are immune. R equals S times R0, where the S is the proportion of the population that is susceptible to catching the disease. As we have seen, if we can control the effective reproduction number R at below 1, the disease won't turn into an epidemic. Then the disease will eventually die out, as less and less people will be infected. So we want R equals S R0 less than 1, which means the S should be less than 1 of R0. It translates to 1 minus S should be greater than 1 minus 1 over R0. Here, the 1 minus S is the proportion of the population that is immune to the disease. Therefore, to achieve the herd immunity, we need to make sure that at least a proportion of 1 minus 1 over R0 of the population is immune. For COVID-19 R0 between 2 and 2.5, we plug this into the formula. 1 minus S should be between 50 and 60%, which means we need 50 to 60% of population immune. How are we going to do that? Well, ideally, we would do it by vaccinating at least 60% of population. In the absence of vaccine, we can hope that this level of immunity will be achieved naturally by people becoming sick and then immune. The other option is to lower down R0, which in turn will lower down the number of 1 minus S, proportion of the population in need of herd immunity. Practice social distance will help us bring down R0, which will help to slow and stop the spread of the virus. So please stay home and stay safe.